if I traded it all, if I gave
Welcome
it
back, everyone. We're live on Facebook again now, so hi to everyone that's watching. You tune in. You can also call in here for anything that you are listening to. I've got my lines open here for the rest of the show for everybody to call in and get any of the things that you've been hearing here. My next guest has been on with me a couple of times. He also does another radio show here on KFNX. I have with me Dr. Frost. He's the owner of AZ Regenerative Medicine. Welcome back to the show. Tell everybody a little bit about yourself and what you do.
Well, I'm a native here, so if you haven't met one, here I am. I hear that a lot. I have been practicing since 1992. I'm a chiropractor and a physiotherapist. My major's anatomy, and I was a sideline doctor for the semi-pro football team with the Arizona Football League for about 7 years, and then I worked with the Fellowship of Christian Athletes for 8 years in Memphis, and we were able to help those kids, give them a physical and spiritual opportunity that otherwise they may not have had. Been in nutrition since I was 12, and I'm old, so I'll let you guess that one if you wish.
That's okay, I'm 2.
I have been practicing helping people. My lifelong gift and desire and purpose is to help as many people as I can while I'm still able to, and constantly trying to advance my way, my mental and physical abilities to be able to help those that need the care, to keep them out of pain, get them off drugs, and keep them out of surgery when it's not necessary.
Okay, so I want to talk a little bit about your clinic, because you offer some special things and you're kind of broadening your spectrum a little bit. I want to talk about that today.
So we have an integrative clinic, and what that means is we have a naturopathic medical doctor that comes in, and he works with me on doing PRP, hormone replacement. We do prolotherapy. We do nutritional. We do chiropractic, spinal regeneration, disc regeneration without surgery. We do stem cells and other advanced regenerative options.
Wow. Okay. Now, today you said to me, Carol, we're going to do something special. We were talking a little bit about hormone replacement, which we're going to do that. And I have to say, I do know that people love these things. That you're going to do for them a hormone replacement. What is it you're giving away? You say it.
What we're doing is we'd like to help the men out there in reference to hormone replacement and testosterone. And the reason I'm focusing on the men today is oftentimes when people talk about hormone replacement, we think about estrogen and progesterone in women, and sometimes the men don't think they need that care. They don't need that help. They don't need that check. When reality says, as we get older, our testosterone starts to drop, and it affects our ability to sleep. It affects our moods. It affects our ability to perform in multiple areas of our life, such as even having energy in work and that vivaciousness we had when we were in high school and college and playing football and running up mountains, and we just start to lose that after a while. And so it needs to be checked, and it needs to be supplemented as we start to decrease over time.
Now, here's what I know something about women. I have to say that. I'm saying women for a reason.
Please.
You're the catalyst of everything. So if you're sitting there and you're like going like, maybe you're elbowing your significant other,
yes,
and if maybe your significant other isn't sitting with you, or whoever it is that that might need something like this, you can call in too. That was my point.
Absolutely.
Yes, he's focusing on men, but the women can call in for him. And you're going to also get a vitamin B12 shot that goes along with that.
Yes.
Everyone loves those.
Absolutely.
Why is that?
Well, vitamin B12 is key in being able to harness the energy that you have just waiting to be used. So it's not just B12. That's just one B vitamin. We actually do a B vitamin complex, and so it includes all the B vitamins, and that really helps people to kind of get them through that week and use the energy they've been storing up from the food they've been eating. I do want to mention something on the women's side, though. Women, you're not excluded. We do help you as well.
Right. I was going to say that.
Yeah. So you're not excluded, but men losing their testosterone oftentimes is difficult for a man to admit, and then there's other men that they're proud to say, yes, I do this and I have this problem and I want to get it fixed. And so if you're those men out there, or even the women who know the men, it's a sensitive subject. Sometimes it does need to be helped delicately, so we're very private in our clinic and making sure that your privacy is also protected. So when you come in, be assured that we're going to protect anything you have to share with us at that time.
We've got our lines open here, and our number here is 602-277-5369. Toll free, it's 1-866-536-1100. He is located at 40th and Bell Road, right in Phoenix, off the 51. And the phone number there is 602-992-2656. And we've got our lines open here for everybody to get entered into win. Well, we're just going to, how you want to do that. But
I want them to come in, Karen. I want them to let them know that they actually heard this program. They have to mention your program to get that free B-complex injection.
So call us here at 602-277-5369. Toll free, it's 1-866-536-1100. I'll get you connected with him, and you can tell him you heard it on the show. Also, if you want to call direct, you got to tell him that you heard it on the show for this too.
Absolutely.
Again, that number is 602-992-2656, or call in here at 602-277-5369. So where could people, you have a website, tell them about that, so because you have a lot of information there.
We do, and our website is still being built. More testimonials are being put on there, but you can go to azregenmed.com, or if it's easier for you to remember, you can go to azregenerativemedicine.net. Think of a net capturing all the things you need for your health, so azregenerativemedicine.net.
Again, our number here is 602-277-5369. Check him out on the website. It is Regenerative, he's got it like this, azregenmed.com or azregenerativemedicine.net. Okay, I want to go into something with you because you mentioned it pretty fast, and though it's a lot of people kind of are getting to know it more and more, it's all still very new too, is the stem cells. Let's talk a little bit about what that is.
So we offer stem cells and other advanced regenerative medicine. There are other things that we can do with stem cells, but I would like people to be educated on a high level so they can grab a hold of what this new future of medicine is. Some of the advanced options that we offer are PRP and prolotherapy. So PRP is actually what they call platelet-rich plasma. That's when they draw the blood out of you, so it's your own blood. They spin it down, and they get the red blood cells to pack down, and they take the top part, which is clear, which is highly concentrated of your own growth factors, that they will inject back into a part. Dr. Miller will inject back into the part that you're complaining of that has been damaged, either soft tissue, cartilage, to be able to help your body to heal itself with its own stem cells. Very effective, but it is
safe.
It's very safe because it's your own that we're pulling out and then putting back in you, and it's aseptic. It's all very clean.
How long when someone does that? A lot of people have questions because you're sticking a needle in me and you're putting stuff in me that was in me before.
Yeah.
So, what kind of effects do they see? How soon do they see it generally, and all that kind of stuff?
So PRP, I call it the pre-regenerative future, or it's the past. It was before what stem cells came along, and is now offering on a greater degree, and we'll talk about that in a minute. But your PRP, generally, you'll need to do an injection into a site, and then about 4 weeks later, you'll do it again. It takes a few of these injections over time. And so I do have questions come up. Even today, a patient came in and said, well, how often do I have to do this, and when do we know it's done? Well, if your pain is gone, it's done, but we don't do more than 4, and if we don't get the results what we're looking for, then we look for another option to be able to rebuild and or refer out if we have to. We hate to do that, but sometimes it's necessary.
Right. Now, let me ask you, too, is it like an alternative to surgery?
It can be. PRP is very helpful in moderate strain sprains and mild strain sprains. When it comes to a complete...
What's a strain sprain?
Well, that's good. A strain sprain. When you sprain your ankle?
Yeah.
Okay, and it swells up, well, that's when you tear the tissue slightly.
Okay, gotcha.
And it can be all the way up to the last fiber being torn. Once that last fiber is torn and it completely separates, PRP is not helpful at that time. That is a surgical situation.
Okay, now we've got our lines open here. Now, interesting that we're talking a little bit about stem cells and PRP and hormones and men getting the hormone replacement, sort of like a seesaw here, but at the same time, you're a integrative clinic.
That's correct.
So we've got our lines open here, and we've got everybody that you're going to get this B12 shot. It's a complex of everything, and you do have to mention that you heard it on the show. Call in here, and I'll get you connected with him at 602-277-5369. It's interesting when you have two doctors in that they sit and talk while we're coming on the radio. But welcome back, everyone. But it's very interesting. I thought that was really funny. We are talking here with Dr. Frost, and he is the owner of AZ Regenerative Medicine. I'll get it out. It's an integrative clinic.
Yes.
They are talking a little bit about two different things, but focusing a little bit about the stem cells, which is pretty interesting and pretty new. We do have our lines open here. Men out there, listen up, and women, if you know a man you can call into, that you're getting this hormone replacement. It's sort of a therapy that you're going to get from them, and you're also going to get this vitamin B12 complex shot that everybody seems to love those.
They do.
So we've got our lines open here, and our number here is 602-277-5369. Toll free, it's 1-866-536-1100. I'm going to get you connected with them so that you guys can say that you heard it on Networking Arizona. And if you call direct, you can also tell them that. The number is 602-992-2656. I want to give out the websites again. Tons of information there for you guys to start getting,
yes,
which is azregenmed.com or azregenerativemedicine.net. Okay, so let's go back into these stem cells. The causes, what causes the problem for them to need it?
Usually it's a biomechanical stress on the body that does not get resolved quickly enough. And so the body is the joints are designed to go into certain positions, but if it stays in that position for too long of a period of time, it has a tendency to become irritated, then it becomes inflamed, and then it starts to wear out and break down, and it starts to adapt and remodel to that new stress. This is where it's what we would call degenerative arthritis.
Okay, so, I have that. I have to tell you.
I'm sorry.
I do. I was told I had that. That's something as a degenerative bone disease. I don't know if that's the same thing. Sort of it was bone on bone. Is that the same thing? Sort of?
So bone on bone is like the ultimate end of the degenerative arthritis. If you're truly
like
bone
you're
on...
done. That's it.
Yeah.
I know. I'm one that you have to say sorry. No.
Yeah.
But the funny thing is that maybe, I don't know what it is, doing the show or something, I feel fine though, really right now. I don't do better than ever before. But I am interested in listening to what this is, because to me, there's a lot of people out there. We were talking about this earlier, how so many people out there are reaching for finding something because they go to doctor upon doctor and do so many different things, and it's just not working.
And I have a PowerPoint presentation that I give, and my next shows in my clinic are actually coming up on March 6th and February 6th at 6:30 in the evening. And so these are free. We have an availability for 18 to 20 people in the clinic, and it's about a 45-minute lecture, and I will be teaching you about what's on the forefront, because I'm actually on the frontier. I'm part of Stem Cell Institute of America, which is a group of prestigious doctors and throughout the United States that are educating the community to be able to know what the future of medicine is, to hopefully get them out of pain, to hopefully get them off of pain meds or prevent them from getting on it, even avoiding unnecessary surgeries, or a surgery at one time that was necessary, but now we have this option to be able to avoid it. And, a lot of people don't realize that it's out there. So unless people like myself and other doctors are out educating the public, there's no way for them to know. And, I asked the question to the public, would you really have surgery unless it was the absolutely last opportunity to be able to increase your activity? And a lot of people say, well, absolutely not. And so this is where we have to educate the public of why they're saying absolutely not, and give them an option to say absolutely not, let's do something different. And that's what stem cells and amniotic tissue are actually doing. They're regenerating and rebuilding the cartilage of the joints, the ligaments, and the tendons to help you get back to your lifestyle you used to be in.
Well, I'll tell you, and our retired doctor here is sitting here shaking his head, and just a regular MD, right? MD, not that you even specialize in this, but you know about it, and it is so interesting because people are afraid of it for some reason. I think it's the needle part. I think it's the needles. I really do. I think it's the needles.
Well, I had a lady come to me, and she said, how painful is it? But she had like 6 injections of Kenalog, which is like a glucose steroid. And she had them over. I said, how painful? I said, well, it's no more painful than you getting that shot.
Especially if you're going to get Botox and all of that. You're willing to do that, but you're not willing to do this. Isn't that interesting?
And a lot of people, Carol, don't realize and don't think of the ramifications of a surgery such as a knee replacement, a shoulder replacement, or a back surgery. They forget the fact that they have to go under general anesthesia they may not come out of, or they may not come out the same. They might end up, getting through the surgery, waking up, but there's a blood clot that might break loose and cause catastrophic issues. There are the rehabilitation time. Just for a knee alone, you're looking at 3 to 6 months of rehab to get back to normal, and that's on a good case. When they do spinal surgeries, I'm a chiropractor, so I know a lot about the spine. When they do spinal surgeries, the average person that has a surgery will end up with about 3 of them before they pass away statistically. And there's only a 35% chance they're actually going to be successful. That number of 35% is actually those that are athletic, they're young, they're not overweight, and they're in prime shape. It's about a 72% failure rate. And so if we can avoid that, if we can rehydrate these degenerative discs, which is something that I'm an expert in doing, I've done that for 10 years, of rehydrating the discs and get the water back in there and pull the bulging discs back in, that's key. However, just because we've done that as physicians, regardless of what kind of physician we are, if we don't retrain the neurology, the brain, that which controls the rest of the body, and put a permanent memory in there, it's most likely going to come back. And in my clinic, what sets us apart from others is we actually teach and train them how to keep that as a permanent correction after we get them to that level.
Their phone number is 602-992-2656. They're located on 40th and Bell in Phoenix, right off the 51. When you work with somebody, do you usually, when they call you, what do they see when they come in? How does it work? When they come in, you sit down, got to talk to them about their story.
Well, first of all, people's time is very precious, so we have a no-wait policy. And so when you come in, you'll fill out just one sheet of form, and it's just a consultation form to find out what your goals are, what your history has been, and then I'll sit down with them, and I'll spend an hour with them, and I don't charge them for it. And normally it's $143 to find out if we can help them. I don't believe that we should really charge somebody, at least myself, to see if I can help them. And so when they come in, they get to sit down with me personally. And if they have x-rays, if they have MRIs, or any reports they can bring, it's always very helpful. If they have a loved one that is supporting them, I really, really encourage them to come along, because that is going to be their support when they're not in my clinic.
That number again to call is 602-992-2656. Tell them you heard it on Networking Arizona, or you can call in here. I'm going to get you connected with them. We're going to get you that vitamin B12 complex. Everybody loves those. The number is 602-277-5369. Toll free, it's 1-866-536-1100.
I'd like to share with the public some of the myths that need to be squashed. So the stem cells are not coming, please listen to me and hear me correctly, they are not coming from aborted children, aborted babies, aborted fetuses, or aborted embryos. This is illegal in the United States since 1998. These tissues that we use in our clinic are coming from amniotic tissue from the inside lining, and there's no DNA developed at that point, so there's no concern about passing that along. And we get our stem cells from actually the Wharton's jelly inside of the umbilical cord. You don't have to remember these words. It's just a special term to let you know that when we get these pulled out, there's no red blood cells involved. So these stem cells...
I had no idea I had Wharton's jelly in my
I know. Who would have ever guessed? I didn't know when I went through medical school there was such thing as Wharton's jelly.
I love that. I wish I could have tried it.
Well, you come in and we can get you stem cells for that if you need it only, but you have to qualify, Carol.
So how do you qualify?
Well, first of all, you have to have something that's actually, this is the right solution for it, and that's why we ask you to come in to do a consult before solutions are given out. We don't give solutions on the phone.
And I'll tell you something, what's really neat is that you get to talk to the professional, which is Dr. Frost, and you sit there for an hour with him and talk to him, and he doesn't charge you for that to do that. And you can find out where you stand. I've got my lines open here for everybody to keep on calling in throughout the rest of the show. The number is 602-277-5369. Toll free, it's 1-866-536-1100. You want to go up on the website, which is
AZRegenMed.
I'm sorry, I'm losing my eyesight here. AZRegenMed.com or AZRegenerativeMedicine.net. Don't forget that on March 26th and March 6th, you're going to do the seminar there as well as at 6:30.